Hi everyone, welcome. We'll start in a few seconds, leaving more time to people to join this call.
Hello, good morning. Good afternoon, maybe.
Good evening.
Good evening from Bangladesh. Thank you.
Yeah, good evening. Very good evening.
Madam, Assalamu alaikum. Ami Shahed, Civil Society Alliance SUN Secretary.
Ji walaikum salam.
জি ভালো আছেন? জি।
আছি আলহামদুলিল্লাহ। আপনারা ভালো আছেন?
Good evening from Chad.
Allô, bonjour à tous.
Assalamu alaikum.
Bonjour de Madagascar.
Bonjour à tous. La société civile de la Guinée est dedans.
Bonjour tout le monde. Good afternoon, everyone. Bon dia o buenas noches o bon whatever.
Oui, bonjour, bonjour, bonjour à vous.
Allô,
Merci.
bonjour tout le monde.
Bonjour à
Bonjour.
tous.
Bonjour Naman.
Tu m'écoutes bien?
Bonjour Inga, bonjour.
Oui, oui, ça va, on vous écoute.
Good morning
Okay.
everyone.
Well,
Bashir.
voilà. Merci. I believe I'll give the opportunity to the organizers to just run through us the modalities of the meeting. Then as the main moderator, I shall introduce myself once the organizers have set the stage for the flow of the event. Over to the organizer.
Hi everyone, bonjour. Welcome everyone. Thank you so much for joining us today for this UN Food Systems Summit Independent Dialogue. So just running through how this is going to happen. So this session is being recorded and the conversation in breakout rooms will be recorded too. May I ask you please to unmute yourself if you are not speaking. This is just to avoid background noise. We have two interpreters today with us. We have Yute, who will provide translation in Spanish, and Maria will provide translation in French. So we have great presentations and group discussions coming up today, but first, please let me introduce you to Bibi Gios, who is our moderator for today. Thank you so much, Bibi, for being with us today, and over to you.
Thank you very much, Alex. By way of introduction, my name is Sept, but I go by Bibi normally, so feel free to call me Bibi. I'm the Senior Nutrition Advisor with the African Union Development Agency to the CEO, but I'm also wearing another hat, which is that of FAO. I'm seconded from Rome to support the African continent, of course, as well as globally. So welcome everyone, and thanks to the interpreters, Ute and Maria, and Alex and other organizers of this important independent dialogue. As you are aware, our topic for today is gender inequality, a key driver to enhancing food systems and good nutrition. Why is this important, particularly in the context of the Food Security Summit, where we had a pre-summit? Now we're going to be having the full summit in the next few days. As you all know, women And when we talk about gender, normally people just think in terms of women, but I think we should be thinking more broadly in terms of gender as it affects different facets of society, not just women or beyond women. Men should be also brought into the conversation. For food systems and nutrition are very important. Why? Because as we move into the next era, and thanks to COVID for allowing us to see the graphic changes in terms of societal, in terms of the geopolitics, in terms of the health, in terms of nutrition, in terms of education, in terms of trade, in terms of the overall economy of, not only the individuals, but the whole continent as a whole. And it is critical that we take into consideration all the different aspects that women and the youth face. First of all, in terms of the youth, we have not had enough attention to getting agriculture, food systems, food security to the youth. So they don't see agriculture, quote unquote, as sexy as one of the youth put it at some global meeting. And the second most important thing is that women, smallholder farmers and small medium enterprises are women, not just in Africa, but globally. And yet they have challenges around the land access. They have challenges around the fact that, especially with COVID, they are not only food providers, but they're also carers. And being a carer can take quite a toll. And this is something that is not much spoken about in the context of COVID as we know it. So you find that women are bearing a huge burden, and the gender inequality. And COVID has just, widened those gaps in so many ways that are unalterable. And then there are the challenges of when women get into farming and get into the food systems, as soon as the crops or the livestock become very profitable, when men seem to take over that space. I think this is something that we should be addressing as part of this meeting, because the way the meeting is arranged, we are going to be starting with 3 panelists that shall open the floor and really set the stage so that we can consolidate at the end of the meeting the outcomes of the 3 breakout sessions that we shall be having that will take about 45 minutes. So without further ado, let me introduce the speakers in brief. First, we are going to be having Inga Ashim, who is the CEO of Save the Children International and Civil Society representative on the Sun League Group. Inga has a lot of experience, as most of you already know it. She holds a PhD, and she is she's one of our specialists in this moderation and in this discourse, in this dialogue. So Saskia will be speaking on the areas around her expertise is in child undernutrition, micronutrients, and fortified food. So she shall be, in a nutshell, wrapping to us what the challenges are when we look at gender equality and gender issues. And we shall have Terry Otieno, who will be speaking or focusing on the youth, as I mentioned that the youth have not been taken much notice, and we are not really focusing on building capacity for the youth and really ensuring that there is a sustainable approach to how we should be dealing with food systems in totality and dealing with the 3 facets of malnutrition, which is undernutrition, meaning wasting and stunting. Secondly, we are having a huge problem of vitamin and mineral deficiencies around the world. And thirdly, we are seeing a rising problem of overweight and obesity. So how can we look through nutrition look at nutrition through a gender lens so that we are able to holistically and in a very multi-sectoral approach deal with these challenges in a sustainable way, so that by 2020, by 2030, when we reach the goals of the Sustainable Development Goals, we can see that we have really moved the needle a little bit, at least to improve and to cover the losses that we had gained before COVID hit. So let me hand over to Inga and hear what she has to say. Over to you, Inga. My pleasure to bring you on board.
Thank you so much, Bibi, and thank you all for being here today. It's a pleasure to be in this independent dialogue with you here today and talk about this very important issue. Addressing malnutrition among women and girls is vital to support sustainable food systems, health, people, and planet. And as Bibi has already shared with us, we know that women and girls experience poor nutrition disproportionately. 60% of the world's people with chronic hunger are women and girls. So this is a real challenge that we are facing today. This is influenced by social processes, power dynamic, and decision-making about how food is produced and consumed, and how nutrition services are provided and used in different contexts. And despite the fact that in many countries, women are planting the food, work the fields, harvest the crops, and do the cooking, they're often the last to eat, and they eat the least. And because of this and other factors, over 1 billion women and girls around the world suffer from malnutrition. So it is a very important issue that we are talking about today. But in order to change things, because of course we need to change the situation, we need to get it right. And we need to do that by transforming the way we think about nutrition and gender equality, because they are reinforcing one another. And we need to think differently in order to act differently. And I think it's really key, as Bibi was saying, to emphasize that this is something that all of us need to engage in. Of course, women play a role, but we need to make sure that boys, men, community leaders, they all have an important role to play, because this is a challenge that we all have in common. And it is not enough just to apply a gender lens to reveal how the existing systems and structures affect nutrition of women or children. But we also need to make sure that gender equality is the central linchpin upon which we build multi-sectoral responses to nutrition. And we need to make sure that women and girls are able to access their own agency over strategic life decisions. They must have access to and control resources in their lives. And also, of course, making sure that both informal and formal structures around them support their opportunities to improve their rights to good health and nutrition. I want to talk a little bit about the gender transformative framework for nutrition, because I do think it is an important example of how a gender transformative approach in identifying solutions to deliver nutrition can be applied. And it is about recognizing that empowering women and girls is the central ingredients for systems transformation to ensure good nutrition for all. It draws on global research and practice, and it offers a practical model and tools for policymakers and practitioners to close the gender gaps for nutrition. Applying such an approach also highlights the ripple effects across multiple domains of a girl's lives, especially when food systems, health systems, and the education systems, among others, take a coordinated gender transformative approach to ensuring an enabling environment. And we have, as I said, a lot of research and data behind this. And we know that girls who have control over their own diets, what they eat, are less likely to suffer from anemia. They miss less days of school. They have better school performance and overall more energy. And at the same time, girls require access to and control over resources to support optimal dietary practices, including education, knowledge, and control over resources allocation. Finally, gender norms related to food consumption determines what it is considered safe, acceptable, affordable, and adequate for various gender and age groups. It is important that gender and gender transformative approaches are at the center of efforts to improve nutrition. I don't think I can overstate that. And this includes championing gender throughout the current year of action for nutrition and beyond, and including as part of the Nutrition for Growth and the UN Food Systems Summit. Save the Children and the SUN Civil Society Network have been closely engaged with both of these processes, representing civil society to help drive forward a successful year of action. For UNFSS, we have worked to engage with the Secretariat and through a central role on the UNFS Civil Society Group of Friends. And we have also worked in close collaboration and coordination with the government of Japan from the outset, including through the Nutrition for Growth Advisory Group, to share our knowledge and our expertise to help deliver a successful summit and nutrition year of action. We are helping to connect global policy discussions with local advocacy efforts in order to see as many countries represented at both summits and get up to make strong commitments. Save the Children, along with other SUN Civil Society Network members, youth leaders, alliances, and individual member organizations have been instrumental in engaging in national and local advocacy. This includes putting women and children front and center of policy dialogues and decision-making processes in the lead up to the UN Food System and Nutrition for Growth summits. Engaging civil society in multi-sector and multi-stakeholder collaboration will be vital to improving gender and nutrition. Civil society plays a key role in generating local data, bringing country experience and locally based solutions, in reaching the most marginalized, in informing plans and policies, in monitoring delivery of planning and expenditures, and in holding leaders to account. The SUN Civil Society Network and Youth Leaders for Nutrition have demonstrated great leadership throughout the nutrition year of action by engaging their governments and other actors to make commitments, by coordinating and contributing to Food Systems Summit member states and independent dialogues, and now joining the newly formed coalitions while sharing the local expertise in innovative solutions. We must continue to open up and guarantee space for civil society communities, and in particular children, youth, women and girls, to have their voices heard, meaningfully engaged in decision-making and monitoring, and to be able to hold their governments and other stakeholders to account. This will be vital for driving nutrition action and process. And I just want to close by reinforcing how critical it is to make sure that the people we talk about are involved in the conversations. And that's also why I'm so happy that on the panel with me today, we have representatives that are actually doing the work in country, but also that we are having someone who is a strong youth advocate and can also share that perspective with us, because it is about the women and the girls and making sure that they are part of the discussion and the solutions. Thank you.
Thank you very much, Inga, for that very insightful and very coherent insights that you brought into the discussion. And I deliberately wanted you to speak first, so as to, for us to get an overview of what the issues are, what the challenges are, and how we can actually address the issues of, one issue that I've picked up, is always that of fragmentation across and by sectors. We don't have a very coherent and cohesive multi-sectoral approach to a lot of the issues that we need to address. And I think it is something that I hope that in the breakout groups that can be picked up very, very clearly. Another aspect which we should touch upon is that of research and transformation thereof, which is very critical, because usually we have the research, we have the science, but it doesn't trickle down necessarily to the policymakers so that they understand it, and then they can translate that through a very critical legal instruments so that the program makers can be in a better position for their capacity to be built and for them to be able to really go to the grassroots and address the issues. I overlooked mentioning the fact that we were expecting a representative from the government of Japan. Unfortunately, at the last minute, they were not available, so that's unfortunate. However, we hope that in the report, they might send their contribution so that it is included, since they are part of the organizing of this very important independent dialogue. Now, without further ado, I'm going to ask Dr. Kazi Zebunesa Begum, who is the Bangladesh Sun Focal Point and additional secretary to the World Health, and for us to give us, a very pragmatic approach in terms of what Bangladesh is doing around this issue of gender equality or inequality thereof, so that we understand fully. And then after that, we'll get a perspective from Terry Otieno, who is a youth expert. So for her to give us a flavor on what the youth are really thinking in this area. And one thing that I must highlight, as I noted in my opening remarks, that one of the challenges that have been brought about by COVID is the closure of schools. And we know that in many cases, children are only having access to that 1 meal a day. And one of the things that when we look at gender, girls are actually more and better attracted and have a better opportunity when they get, that school meal that is nutritious, not only for their growth, but for their economic opportunity. So let me hand over to Dr. Begum. Over to you, sir. You have the floor.
Thank you very much, Ms. Baby. I'm delighted to hear doctor before my name, but I'm not a doctor. But it sounds very sweet. Yeah, so thank you very much. Yes, this is actually a great privilege for me to speak here. And this is a really wonderful initiative to bring gender equality as a key driver to enhancing food systems and good nutrition in the table of discussion. What you have just mentioned regarding the school feeding programs, I am happy to declare that our schools have been opened today. It has started their normal courses throughout all over Bangladesh, and children are really very happy to get the opportunity after a long break. It's almost 1.5 year break, and then they could go their very favorite place, their schools, colleges. It is really a very favorite place for children. And also, yes, during this COVID period, this opportunity was not there to get 1 meal a day, at least from the school. But we had before also we had a very good discussion that how we established the food supply chain system from the center to the village and to the heart to reach areas even. We had government initiatives to to fight against hunger. Our Honorable Prime Minister declared that no one will die for hunger. So it was a great initiative during this COVID period. It has been done through a great policy. There were Agriculture Ministry, Food Ministry, Health Services Ministry, Communication Ministry. Everybody actually worked together. Local representatives were given the responsibility, and all the executive head of the ministries were given the responsibility to look after the matters, even in the rural areas, everywhere. That is a great policy from our Honorable Prime Minister, which were taken during the first, last year, actually. So regarding gender and nutrition, I can say that Bangladesh has immense progress in poverty reduction with sustained economic growth which results into poverty declined from 44% in 91 to 13.8% in 2016 and 17. So in other human development index also, like life expectancy, literacy rate, per capita food production have also increased significantly in our country. So progress was underpinned by 6% plus growth over the decade and reaching the 7.3% in 2016 and 2017. So from the recent national surveys, it indicates that gradual decrease in malnutrition, maternal and child undernutrition, increased access to health care, water and sanitation conditions are improving, which collectively contribute towards overall health and nutritional status of women, adolescents, and children. You know, being one of the lowest middle income countries, Bangladesh started satisfactory preparation to formulate national policies and design investment plan to support sustained economic progress, promoting women and girls empowerment through institutional and agency engagement. And also, you know, I am very happy to say that unlike many other countries, Bangladesh started vaccination very early, could start it, and it actually, you know, contributed a lot on our health issues, especially COVID issues. And you know, our economy, we could actually keep our economic cycle moving on, especially because our industries, our garment industries and other industries were not stand still. It was working throughout all the you know, COVID situation also. So we are in a good position, and to you know, to engage our women and our workforce to work in their industries and in their sector, so that they can earn and nobody you know, dies for hunger. And especially during this COVID situation, we tried to provide nutritious food for all the people through, yeah, we had a lot of campaign, a lot of advocacy and other programs, and side by side, our ministries like food ministries, agriculture ministries, they had packages, programs for the people of every corner of the people, so that nobody, especially for girls and women, so that they don't face any sort of, you know, hunger or malnutrition. I would like to say that we have revised our major policies like the Food and Nutrition Security Policy 2019, the 8th 5-year plan 2021 to 2025, National Agriculture Policy 2018, National Agriculture Extension Policy 2020 are articulated pathways of development with women and especially focused on women's participation, recognized their role in the development and promotes institutional leadership role to contribute overall development of Bangladesh. During the year of Nutrition for Growth Year of Action, Bangladesh is also committed towards ending malnutrition by 2030. In order to tackle malnutrition among women, adolescents, and children, Bangladesh National Social Safety Net programs are expanded with additional investment in the country's annual budget in last 5 years. The objective of the social safety net programs are laid out to protect from poverty and social empowerment, like maternity allowances has been revised, transfer value increased, and planned to expand half of the geographic areas of Bangladesh by 2021. Stipend for female students to promotion education, promote education. Fortified rice is included into the VGD program in the rural construction works where laborers are mostly women. Fortification program of oil and salt is ongoing under leadership of Ministry of Commerce with private sector engagement. Additional investment plan on social safety net for urban areas with growing urbanization in Bangladesh. From the analysis of Bangladesh food and nutrition security policy and national nutrition policy reveal that major drivers of chronic and acute malnutrition focusing on intergenerational malnutrition are included with a sequential approach to support from a multi-sectoral approach and establish a monitoring system. From the policy analysis, it shows that recent revisions of all Bangladesh national policies put special focus on women participation, access to finance, and encourage women leadership with emphasis on nutrition to promote their sustainable changes over the last few years. Being champions in there are certain challenges and potential opportunities which are also under consideration during the discourse of development journey. However, COVID-19 has substantial impact on the poverty reduction and nutrition on women and children, which are being tackled by GOB's special initiatives through special programs in the last 1.5 years. With this, I would like to conclude my answer or speech. Thank you very much.
Thank you very much, Kazi. Don't worry about me calling you doctor. People call me doctor.
No, I'm happy.
I have to run and get that PhD.
Yeah.
No, thank you very much. I mean, I particularly liked your emphasis around the fact that national policies have been revised, and you have a strong multi-sectoral approach, which has a focus on women, and the fact that you seem to have a good fortification program, which usually is a solution to some of the micronutrient deficiencies that are of public health challenge. And on the homegrown school feeding, I would just like to highlight the fact that you see a program like homegrown school feeding is actually a multiplier. There are win-win-wins because it's about stimulating smallholder farmers. It's about feeding and nourishing the children. It's about them, being better able to absorb the education they're given, and it is better able to attract not only attendance but retention in schools. And the girl child does benefit quite a lot. And to remind ourselves that out of the Second International Conference on Nutrition and the Rome Declaration and the 17 areas of focus, indeed, school feeding and gender are some of those areas that are quite highlighted. And then we have the Decade of Action on Nutrition, which again emphasizes gender issues and the safety network programs that countries should be focusing on. And last but not least, recently, as you know, there was the launch of the CFS voluntary guidelines on nutrition and food systems, which again further emphasize, issues in relation to culture, food sovereignty, as well as the right to food. So I believe that this discussion is very, very important in terms of looking at how we bring together all the different aspects and ensure that, we see nutrition and food systems through a proper, gender lens and not leave no one behind. So thank you once again, Kazi. And let me, without further ado, call our youth representative by the name of Terry Otieno. I believe you're from Kenya. Sindio.
Yeah. Hello.
Habari za maisha?
Nzuri. My name is Terry Otieno, and I'm pleased to be here. Yeah.
Okay. Over to you, Terry. Let us hear what the the issues and the challenges of the youth are and how you feel, we as adults, if I may call it that, can help us to help you, better engage in issues of gender, issues of youth engagement in agriculture and food systems, as well as nutrition. Over to you.
As you mentioned, when I think about the youth and our engagement and role in any system to this point, we kind of face the same challenges all the vulnerable communities such as women and children face. And that's why I'm so passionate to talk about this, because at this moment where every region across the world is suffering from the effects of the pandemic, I feel that it's time for our voice as youth to be heard and for us to be included in every sphere. So allow me to share my screen. I am going to share my presentation. Let me know if it's on. Okay.
Yes, it is on. We can see it. If you can just put it on presentation mode.
All right. So, a short introduction about myself. I am Terry, a Kenyan youth. I'm passionate about social services and our aspects. And I'm a youth, a leader in one of the youth entities that work hand in hand with the UN, formerly UNMGCY, but currently known as MGCY. And I am also a volunteer and a youth leader in Kenya Red Cross. That said, I would like to start with my presentation, and I'm going to speak about women as key actors for more resilient and equitable food systems. So most of the times, whenever people hear the word woman, there's kind of some stuff that people think about. So what pops up in your mind when you hear the word woman? Some of the words are vulnerable, bias or discrimination, marginalized. We tend to imagine that whenever there's a topic about women, then it revolves around reporting that a woman has been abused, there's gender discrimination or marginalization of some sort. Today, just like yesterday, women have continuously proven such assertions wrongs in order to be able to be given a place at the table. I mean, unless you prove yourself to be worth it, then no, you can't be allowed to speak or be seen as a symbol of strength. So whenever it is a woman is referred to as, that woman has made it, that woman is strong, it's because that woman went above and beyond to prove that apart from being a woman, I am much more than this. So yeah, that's it. Sadly, even in a critical system like the food system, where women are the key of the food system, we still have to prove ourselves in order to be given spaces to discuss much more than what are we going to have for dinner or when are we going to harvest whatever it is we planted. So it's too often we only focus on the roles of the women in the production, processing, trading, or food in the making of, but in the making of bigger decisions, women still lag behind. What is a food system? It's the common processes that allow the production and distribution of food. So just like it sounds, it's the production, processing, transport, and distribution, as well as consumption and disposal of parts of the food. So in order for this food system to work, we realized that we need to start from the farm where the production begins to where we eat and have refuse to dispose. So what can women do in order to make the food system more resilient? What can you as a youth do in order to make the food system more equitable and resilient. We realize that a lot of women nowadays have gone above and beyond to join different systems that allow us to contribute directly or indirectly to the food system. We have women and youth advocates that are really good in climate change calls, also smart farming, food industry research and development, as well as disaster risk management. I have examples of Kenyan youth such as Esther Murore, who is also a vocal person in the MGCY space. She has really done a lot in terms of bringing change and advocating for good climatic behaviors. We also have very big companies such as Multi-Stakeholder and let me get the name, AgroWatcher, that have also taken big strides in digitalizing the agro sector, in making sure that we do not have plantations as usual, and getting more and more apps that can record and report agri-related aspects. So this is what women have been doing, and we are hoping that we can do more. So we need to do much more than going to school, studying, and being able to do what we have learned. Much more than it, we need to break biased cultural practices. We realize that as women, children, and youth, we are brought up and get so comfortable living in what was there before us, ways of life, customs, and norms. You find it's the woman who works and comes back home, cooks, and then lets every other person, from the husband to the children to any other visitor, serve the food. And when that happens, there could be a point where the food is not enough. And okay, sorry, I'm getting some voices. People are talking for me, and it's kind of confusing.
May you kindly mute yourself if you're not on the floor? Thank you.
Okay, so as I was giving an example of the kind of biased cultural practices that women, children, and youth should change. It's serving food. A woman comes, cooks, but allows every other person in the house to serve first. This is a very simple thing. But if we continue going to school and learning and working professionally, but not able to fight such biased practices, then we as women, children, and youth will still be far behind in trying to make the food system equitable and just for everyone. We also need to focus on nutrition, health, and interventions. Much as we go out and wish to be nurses who take care of others, we have to also make sure that at home, the food that we eat is nutritious. Let us not just look for a way out to eat and be full without looking at the nutritious aspects. We also need to reach out to the vulnerable in the community, the other areas in the region where food is scarce, and make sure that they have nutritious food. We also need to seek salary for the unpaid labor, because we realize, as I defined what the food system is, majorly, the food system comprises of production, processing, transport, consumption, and disposal. These 5 areas take a lot of women in order for them to exist and even work. But the women are not paid. This is something that we do as women or youth that is expected of us simply because we're there, we exist. So if we start saying that this is work for us, if we go out to the farm, if we go out into the market, if we cook, we expect it to be paid. we expect other people in the community to see it as work. Then if we get a livelihood from the food system, this will be a very big and powerful way of making sure that the food system becomes equitable and just for everyone. Also need to lobby the government and finally promote leadership in the food system. And in my conclusion, there is no one size fits all approach that will see women become key actors in making the food system resilient. However, what you and I do wherever we are is one step closer in achieving a healthy nation full of women who are powerful and happy. Thank you.
Thank you very much, Terry, for such an impassioned speech around women and girls. And I believe that some of the points that you raised actually are some key things that have been bugging my head, if I may put it like that. Issues of the fact that women don't have much voice in terms of the agenda setting at policy level, at parliamentary level, as well as even in the local cultural economy. So we find that some of the barriers that come about are precisely because of the traditional thinking, which really should transform around how women position themselves and are positioned within the whole transformative agenda for improving the food systems and the nutrition. And you mentioned climate smart agriculture and environmental changes. These are key because when we talk about sustainability, it should be about people and planet health. That is very key because one affects the other. And unfortunately, with COVID, we've seen that a lot of things have changed, and hence, I would like to emphasize that we have to go back to the basics. Every region has a very particular context, which hinges upon the traditional and indigenous food systems and nutrition and the way we do agriculture. There's no one size fits all, like you say. We have to be very context conscious and context specific. As I was looking through the charts, I noticed that McMahon has a concern around the fact that we haven't mentioned the word 1,000 days. We probably took it for granted because indeed, as we all know, 1,000 days is very critical, from the conception to 24 months of a child's growth, because by the time a child is 2 years of age, all the damage is done. In the fact that their brains haven't developed adequately, therefore, it is very hard to have what we call catch-up growth. So thanks for mentioning that, McMahon. As you know, this event is jointly organized by SUN, by 1,000 Days, by Results, by CARE, by Save the Children, by Multi-Nutrient Forum, and then supported by several other partners. So thank you very much. I would like, during the breakout sessions, for the issue of ensuring 1,000 days to be really taken into consideration. But looking at 1,000 days, a child's development does not stop there. That's why we have school meals. And I was very, not puzzled, but not surprised when Kazi mentioned that, since COVID, schools have been closed for about one and a quarter years or 1.5 years. That's a long time, that's a long break. And a lot of countries have actually been grappling with how they fill that gap of the school meal in terms of either delivering parcels or identifying a different delivery modality. So thank you very much. I would like some guidance from the organizers. We are going to be breaking into 3 panels that will be discussing different topics, and they shall be led by all the people that you know fully well. I don't have to introduce them per se. However, it will be good to know which rooms each is going to be going to. The first panel is going to be focusing on women and the 1,000 days window, and it was preempted by Mark, and it shall be led by Saskia Osendap. And the second breakaway session will be on human rights accountability. And human rights is very important because we talk about it, but we don't actually walk the walk. That will be led by Mike. Mike is Mike Kunga. He's a nutrition professional with several years, and he's a strong youth leader for nutrition. And I'm sure he'll be buttressing some of the points that Terry raised. So that will be the focus. And then the third breakout session will be on women as economic actors. Because like we say, women are usually the breadwinners, the carers, and yet they are not given the opportunity nor the economic space to be their own persons and to voice their concerns and to be heard. And each of the group is going to be asked to look at 2 key questions. What are the top 3 challenges in putting these recommendations into action? And the second question that you shall be answering are, what are the top 2 to 3 key actions which can take together to put the recommendations into action? Because indeed, there's been so many summits, as we all know. It's not for lack of meetings, and it's not for lack of policies, but what usually is lacking is the how. We know the what, we have exhausted the what, but the how is usually the challenge. So I would really implore the 3 groups to look at, the pragmatic and practical approaches as to addressing these key questions that are really around 1,000 days accountability and the actors. So may I get direction as how the groups are going to be breaking up? I know they shall be breaking out for about 45 minutes, right? Alex or anybody?
Thank you very much, Bibi, and thank you to all our panelists for their wonderful presentations. So as Bibi said, we're now going to break out in 3 rooms, and we have 45 minutes for discussion. And to our moderators, please remember to nominate 1 rapporteur per group to give feedbacks of the conversation for when we come back to the main room. So I'm going to send you now to breakout rooms. So yeah, have good discussions, everyone.
Okay, and then we come back to the same link.
And then you will automatically come back to the main room after 45
minutes. And then the rapporteurs be mindful of the fact that you have 5 minutes to make your deliberations as feedback from the group to the plenary. And then we shall have if there's time for 1 or 2 burning questions or comments, we could have those and then we close. Thank you very much. Over to the moderators to break us up into groups. Thank you. But I can't hear. Okay, thank you. So according to my time, it is 14:56. So I'm going to be starting my clock. And in exactly 45 minutes, I would expect that we shall be all back in the room and give feedback. Over to you. Thank you.
Hi, do we have Mike here in this room? Mike is the moderator.
Sorry, can we choose the rooms that we want to go into?
They were automatically allocated. So I'm looking at, sorry, it doesn't seem that our moderator is here. So please let me.
I know he had confirmed because he did send his bio. So he might just be running a bit late, or so there's a glitch with the technology on his side, as it sometimes happens.
Yeah, exactly. Okay, let me message him for a second. No worries, we have a plan B if it doesn't work.
Yep, I was hoping that you'd have plan B or C.
Hello, everyone.
Hi, Mike. Hello.
Hi, Mike. We were starting to get worried that you missed or had a glitch with your side. So thank you very much for joining. I've already introduced you, so you may go ahead with your group. Over to you.
All right, thanks so much. So welcome, everyone. I think we can just do a quick round of introductions. We just mentioned from where we are, that we're connecting, like our countries, our names, and maybe what we are working on, like the organization and the like. Sure.
Okay.
Anyone to start?
I've already been introduced. I'm Bibi Giose, the overall moderator for the session, and I shall be managing the situation as it were. Thank you very much.
Thanks so much. And we can even try to put our cameras on if a situation arises from our side. Sarah, can you come in? Because I think you are next to my screen.
Was that me? Sorry.
Yes, actually, that's you.
Hi, everyone. My name is Sarah Carter. I work for Save the Children in Australia. It's really late. I'm trying to say I'm very engaged, but you'll have to forgive me. It's 11 p.m. here. Yeah, work for Save the Children Australia and working on our platforms ahead of COP and M4G. So this is particularly interesting for me. Thank you.
Thanks so much. Next.
Next, Mike?
Yes.
Okay, hi everyone. My name is Matthew Muru. I'm from Zambia, but at the same time, I also chair the Eastern Southern Africa Civil Society Network. I'm the outgoing chair for the Scaling Up Nutrition Civil Society Network as well. So I'm very interested in this topic because youth participation is something that I hold very dearly and trying to champion in Zambia as well as Eastern Southern Africa. Thank you.
Thanks so much, Matthew. Someone next? Someone willing to come? Can we do as quick as possible? I think we have a lot to discuss, so maybe.
Hello, everyone. I am Carolina Turriago from Fundación Éxito, Colombia. I'm the leader of advocacy, and I'm the coordinator of the civil society network of Latin America and the Caribbean at this moment.
Thanks so much. Thanks so much, Caroline, for joining. Next, please.
I am with a partner who is Natalia Ledesma. She speaks in Spanish, so I wanted to ask if we have a Spanish translation for some people that is here in this group.
Oh, let's see the transaction.
I'm not sure. Oh, thank you.
Well, I'm not sure either. Yeah, sure.
If I may take the floor, I am the interpreter and I'm writing notes in the chat in Spanish.
Okay.
Estoy escribiendo algunas notas en español en el chat para las personas que no entienden el inglés, ¿verdad? Porque no hay posibilidad de interpretación simultánea en los grupos.
Okay.
Muchas gracias, Carola.
Great. Next to do the introduction.
I'll introduce myself. My name is Pat McMahon, advocate for particularly on the first 1,000 days. And I suppose the issue of the right to food, we often see it as a humanitarian issue, but it's very much a development issue as well. And it's really important that we gain a development understanding of what the right to food is. So it's an interesting topic.
Well, thanks so much, Aura. Yeah, thanks so much, Pat. Next one.
Yeah, I can take the chance.
Exactly.
Yeah. This is Khairul Islam, who is working for Save the Children Bangladesh. I am working as a manager for Right to Grow project. It is funded by the Netherlands government. The Right to Grow project, the purpose is to reduce the malnutrition under 5 children and mother of the children, and as a whole ensure food security system at the community level. That's all from my side. So it is very interesting. That's why I am joining in that session. Thank you.
Thanks so much. Thanks so much.
Hi, everyone. Hi, Mike.
Yes.
Hi, Mike.
Hi, I can hear you. I think everyone also can hear you. Introduce yourself. Thanks.
Hi, everyone. I am Seydou Ndiaye. I am Civil Society Network Coordinator in Senegal and CSN steering group member. I am also the national focal point for African Network on Right to Food in Senegal. Thank you very much.
Thanks so much. We have someone quick.
I can go next. Hello, everyone. My name is Chikondi Chavuta. I am based in Malawi. I'm the Southern Africa Regional Advocacy Advisor. And I work on food security, food systems, nutrition, and climate change. Thank you very much.
Thanks so much, Chikondi. Thanks so much for joining. Next.
Hi, I'm Cecilia Fabrizio, and I am the program lead for a consortium called Stand Together for Nutrition, which is a group of experts in food systems, nutrition, economics, that has done some estimates of the impact of COVID on nutritional outcomes. And this year in particular, we're focusing on the gendered impact of COVID on nutrition.
Thanks so much. We have quick 2 or 3, or others might try to introduce themselves through the chat.
Hi, my name is John Otieno. I'm working in Action Against Hunger as a regional advocacy officer. I'm based in Nairobi. Thank you.
Thanks, John, for joining. Another one?
Hi, Mike. I'm Rory, the head of the CSN Secretariat in London. Nice to be with you all.
Thanks so much, Rory. Another one, probably the last one. I think it's better that we quick start.
Hi everyone. So I'm Mathilde Chiesa, current facilitator of this event. So I am the Policy Advocacy Officer for Nutrition at Results UK. And this year, in the Year of Action for Nutrition for Growth Summit, so at Results UK, we focus specifically on nutrition as a human right in our advocacy. So it's yeah, very pleasure to discuss with you all. So Mike, if you're ready to start the discussion, perhaps you can nominate a rapporteur who is going to give feedback at the end of the session. So yeah.
Exactly, Matilda. I think it's better we really start the discussion. So as she has rightly said, before we start, we need to really have a rapporteur who really kind of present the feedback from this room. So who is willing to volunteer to take up this role? Very quick. You can raise up your hand, or you can just type on the chat, or you can just unmute and say that you are willing to volunteer. No one, or?
Mike, if no one wants to take charge, you might just wish to use your role as chair to nominate one.
Exactly. So, by the power vested in me, I will nominate John from Kenya.
Michael.
Yes, John Otieno from Kenya. You will be the rapporteur for this session. Is it okay?
All right, I'll gladly take that. Thank you.
Thanks so much. So we can start the conversation. Our topic is human rights and accountability. But the overall discussion, we know that is really focusing on women, nutrition, and the like. So from the main session, we heard that that will be guided, will be really required to respond to two key questions in terms of the challenges and what are the solutions which we think will be really important for us to address the issues of accountability when it comes to women and human rights at the same time with regard to nutrition and food system. So maybe if I can quick start, this conversation is actually focusing on, we'll be really focusing on two key issues. The first thing, we'll be looking at the recommendations by International Coalition for Advocates for Nutrition and the SUN CSN, and the solutions from the action. So I might help you to really kind of the opportunities of the solutions on the chat box, but the conversation is all about to really reflect from our own perspective and from our own work in terms of what we see the issues related to human rights, accountability when it comes to women, nutrition and food system. So we'll be looking from those areas.
I think I'd like to start with like the right to life and child and maternal mortality. Like these are like the furthest behind is the people and women who die because of malnutrition. So I think if we're looking at human rights, I think we must be far more vocal on maternal and child mortality because these are the furthest behind. And very seldom we are linking the two or the three. So I just put that out there as one aspect of human rights that I think we need to be focused on.
Thanks so much for starting the conversation. Anyone to quick react on that? I hope we do have the next checker for this conference for this session. Is that okay, Matilda?
I don't know if it's just me, but I have trouble hearing. Perhaps can you speak closer to your mic? You know.
Okay.
Thank you.
Oh, sorry, will I say it again? I was just saying about human rights, and if we look at the furthest behind, we need to look at infant and child and maternal mortality in around the right to life. I think it's very seldom spoken about. For example, the Food Systems Summit, child mortality is not mentioned in any of the solution clusters or the solution for the right to life. Yeah, if we're talking about human rights, we need to focus on this.
Thanks so much, Pat. I hope Matize can hear and everyone else can. So, one of the key recommendations or solutions from the action track on the UN Food Systems Summit regarding to the issues of accountability and human rights was to develop new standards and legal framework that would drive private sector change and hold food system companies accountable for their social and environmental impact. I can really take this and put it on the chat box, and we can reflect it from the angle that what do we, let me just send it here. So we can reflect on that point in a way that what are the main challenges in putting to use the accountability mechanism of the UN in the Universal Periodic Review. So from that recommendations or solution, what do we see are the main challenge in putting to use the accountability mechanism of the UN?
Mike, maybe just to give a comment.
Yes, John, you can come in.
Yeah, so especially for, I would say currently with the COVID pandemic and its impacts, especially looking at what we experienced last year about increased number of pregnancy among adolescents, and to see now in terms of access to health services, nutrition information, I think it's something that we also needed to also add. And well, it ties up with what Pat has mentioned regarding focus on women and children who die due to malnutrition, but then now looking at the angle of adolescents who sometimes do not have access to some of these key health services, and that that hinders them in terms of that period of pregnancy and even delivery. And some of these issues could be, anemia that is preventable, and that, at the end of the day, still can lead to mortalities. So these are discussions that we need to also look at, bringing in that the cohort of adolescents between 10 to 19 years who face such kind of challenges. Thank you. From a human rights and accountability perspective. Thank you.
Well, thanks so much, John, for raising that comment from the anemia perspective and all the micronutrient deficiencies that women and girls are really the largest group that are facing that. Anyone to jump in and reflect from the discussion?
Hi, Mike. Can I come in as well, Matthews? Mike, can you hear me?
Yes, Matthews, I can hear you. You can come in. Yeah, sure.
Okay, great. So I think just speaking to the rights issue, I think for me, I was heavily involved actually in just the independent dialogues, especially in my country, as well as also just supporting countries within East and Southern Africa. So there was one interesting component that has come through that also could touch on the accountability mechanism that we're just talking about right now. Most of the stakeholders engaged brought up issues to do with, for example, food sovereignty, seed sovereignty in the whole, food systems discussions. So that is something that we felt that, it needed to be addressed, because in as much as we are trying to improve our food systems or make our food systems be responsive to the current times, to the climate, to the diets, as well as also protecting the environment. One of the issues that people really felt was not working okay is just the fact that the aspect of seed sovereignty and food sovereignty in some of these areas was not being addressed. So you'd have certain regions in certain countries where, people are known for certain foods that are quite rich, that are quite diverse, but, they feel like the whole process, without protecting that and allowing people to grow and, consume the foods that, they're used to, that, is known for their identity, because food means a lot of things to people. They felt that, their rights were being infringed. So that's one area that I felt I could bring to this discussion. Thank you.
Well, thanks so much, Matthews. I think that's a very critical area. And maybe just to reflect on that, within Action Track 5, which I'm kind of co-chairing, there's a solution which we are kind of trying to put it as a the coalition of action is local production for local consumption, which will really focus in terms of protecting the rights of those marginalized who are really producing something within their community, so that they can really put that food which they are producing forward. So I think that's a very good point that we have raised. So can someone also...
Could I just add, I think the right to food is really interesting, but most people don't. We'll say in Africa, 1 in every 5 people are hungry. And I don't think those 1 in every 5 people would necessarily think or consider my right to food as being is effective. And so I don't think we have a strong enough narrative around what the right to food is. Like, if you're malnourished, does that mean that your right to food, do we have a framework to say this is your right to food? You haven't had your right to food has not been met. I just don't see the narrative either within the populations I work within, or within the UN architecture, what actually is the right to food? What is actual hunger? How do we define hunger?
Thanks, Pat. I think you finished. I see a hand raised. Can you come in?
Yes, please. This is Bibi. I just want to acknowledge Mac's concerns. The right to food has been around for quite a while. However, many countries, unfortunately, have not acceded to the right to food. And usually, as he says, how do we define hunger? Hunger comes in many forms. You may be, hungry from carbohydrates, or you may have a different kind of hunger, which is vitamin and mineral deficiency. And so I think we have to, from a UN perspective, but also from wearing my other hat, from an African Union perspective, we should really seriously start advocating and facilitating for legal instruments to ensure that countries truly understand what hunger is and how it affects, especially children and women and young people, in different ways. And then that eventually, because hunger ultimately translates into a fall in the GDP of many countries that we know. So I just wanted to make note of that. Thank you. Over to you, Mike.
Thanks so much, Bibi. I think the issue of advocacy is really coming critical, and I think that can be captured under the solution. So please, John, when you are really reporting from this session, that has to be captured. So maybe just narrowing from the discussion now, we are really looking from the framework, the legal framework that are there by UN. What is the challenge that is making them to really reinforce those legal frameworks? So what are the really critical challenges which countries are failing to put into use these accountability mechanisms? So maybe you can also really narrow from those areas from our own countries or from our own work. What do we see as the challenges in terms of putting to use the accountability mechanism of the UN? And for our Spanish interpreter, I think there's something that has been written on the chat. So maybe for the sake of engaging everyone, those can also be points can also be mentioned in English for others to really follow the discussions.
and for me to also understand.
Hi, Mike. Can I come in again, Matthews?
Yes, you can come in, but I wanted the Italian, if not the Spanish interpreter, to really kind of share what is being discussed on the chat, because I think the Spanish chat.
Okay, maybe I can.
That we also engage everyone.
Yeah, maybe I can wait until they share what is in the chat box. But ideally, what I was going to say has to do a lot with what you were with the question that you've posed. I feel like for me, how the accountability mechanism has to also be translated at national level, because if you have accountability mechanisms that are just speaking to global responses or approaches, and they're not really being seen or being used at national level, then it becomes an exercise in futility at the end of it all. So maybe just some food for thought for everyone as we are thinking about the accountability mechanism. How do we make it work at country level? Thank you.
Thanks so much, Matthews, on that. I think you are quite right. Yeah, we need to really scale down the accountability mechanism. They need to be reflected in our country policies for countries to reinforce those in respective countries. Yeah, so that's a great point that you have raised. So maybe first, as we are still waiting for the Spanish interpreter to really highlight what is being discussed on the chat, we can continue our conversation. So the others, yes.
This is John. So just to galvanize what Matthews has mentioned, in terms of also accountability at country level, right now we've seen the discussions of the UN Food Systems Summit really taking lots of both global and regional discussions, maybe national. But again, in terms of those commitments, how do we now strengthen in-country, even if at the sub-national level, tracking of those commitments, and that they will speak to human rights, and that they will make the accountability where maybe use of certain components of growing even food itself that maybe is not allowed in other or doesn't meet the international standards in terms of utilization, especially maybe pesticides or such like things. And sometimes you'll find it's still allowed in certain other countries. So making sure that that accountability starts from the community level, that local farmer, they're able to understand that certain pesticides will be a repercussion to human health, for example, and that will really help in terms of accountability. That's just my submission for now. Thank you.
Well, thanks so much, John. Said. So maybe if we can also reflect from on how government can enhance the coordination of policies and practices. We're talking of maybe accountability from the UN legal frameworks and the like. Countries, they have to be incorporated into countries' plans and policies. And as John has said, accountability has to come from the community at the national level, all that. So the other aspect which we can really focus on is in terms of the coordination that is at government level or at in-country level. How do we think governments can enhance the coordination of policies and practices, at the same time resourcing and monitoring intervention across nutrition and food system? Maybe if you can also reflect on that.
Hi, Mike. Matthews. Oh.
Well, Matthews, we are, I think, 23 of us right here now.
I know, and I think I've talked too much. So if there's anybody who's contributing, I can mute for now. But I thought there was nobody who was going to submit. But absolutely, I can give chance to somebody, and I can talk later when there's nobody talking.
Sure, I'll give you a bit of time. Let me just hear from others, and if I don't hear from them, I will really come back to you, and you'll be able to contribute. I hear from the rest of the team. I think we are quite 22 here, diverse from different countries, so we have diverse knowledge depending on terms of where we work, and these issues are not quite new for us. So can we really share something on that?
If I may, if you allow me through you, Chair, if I may just come in here and give an example. As the Spanish interpretation, I mean, they're busy doing the other side. I mean, I can understand, I mean, a little bit of Spanish. So to give an example, you see, unlike in Africa, Latin America and the Caribbean have very strong civil society mechanisms. And that has actually forced the government to have more accountability and to really get the consumer to help themselves design what sort of food systems and food environments they desire. So it's a very different way of doing things. And the second thing is, in terms of accountability and reporting mechanisms, Latin America has very strong parliamentary forums that meet so often, and they're able, therefore, to go to their constituencies and impart that knowledge, that forces the consumer to start thinking twice. Because also, the one aspect about accountability is around how do you work with the private sector to make sure that, they do, let's say, front of pack labeling, they do make sure that there's consumer education, they do make sure that people really understand what is in their food. So it is in Latin America and the Caribbean, the smallholder farmers and the civil society thereof that is really at the helm of forcing governments to make necessary changes for the better. Over.
But if I may, I think, I think the grass can always seem greener in the other, like I'm from Ireland, so it's a developed country, yet we have still huge issues with front of pack labeling and, issues around consumer and consumer knowledge. And so I don't like, but I think if we look at the Food Systems Summit and accountability, I think if we read Michael Fakhri's papers on how human rights have been integrated into the Food Systems Summit, we see that it's certainly not straightforward. And even a UN process like the Food Systems Summit has really struggled to get human rights into the agenda. So I think this is a worldwide problem, I would say. And it affects different countries in different ways, like between obesity, early mortality due to obesity, underweight, anemia for women. So I think we're kind of all in it together. Some are more affected, clearly, than others, but I don't think we have the accountability system. If we did, the food system, Michael Fakhri would not be speaking about how the rights to food is not been maintained within the Food Systems Summit. So I'd just like to add that the point.
Well, yeah, thanks so much, Pat, and thanks so much, Bibi, for those really insightful comments. So let me also go into another aspect, a bit not very far from accountability, but in terms of the social norms that enforce inequality in food systems. So one of the recommendations by International Coalition Advocates on Nutrition was to carry out an assessment of social norms that reinforce inequality in food systems, develop a cross-sectoral response strategies that have clear indicators. So what do we see as the challenge, particularly in kind of monitoring these social norms that reinforce inequality in terms of food systems? Maybe as we digest this, Matthew, you can come in with that point which you wanted to raise.
Yeah, thank you very much, Mike. So I guess for me, my submission has to do with just learning from other processes that have worked. So like looking at the SDG processes where at country level progress is required from countries. So on a yearly basis, you are reporting on how much you've achieved and you're reporting on progress. So if we have a mechanism at global level that helps countries to really track their own progress when it comes to the topic at hand, it will be a good starting point. And then from there now, country stakeholders are also forced to engage because before a report is submitted by government on what progress you are making, all stakeholders are brought together, like just like what I've explained, like just learning from the SDGs, where all stakeholders, civil society, government actors, and other players, are all engaged to report on progress. So that kind of mechanism, I think, would be very, very good, just to make sure that we are on track with where we want to achieve and where we want to go. Thank you, Mike.
Thanks so much, Matthews. Thanks so much for that comment. So I think we really need to dive deep into the norms that are perpetuating holidays in terms of nutrition. So maybe you can also reflect in terms of what do we think are the main challenges in carrying out assessment of social norms that prevent the realization of the right to adequate food.
Well, I think food affordability is clearly the key issue. Like 2 billion people cannot afford a nutritious diet. And unless, like, you can have all the consumer choice you want, but if you don't have the food, if you don't have the money to have a nutritious diet, so I think unless we're actually looking at the problem in terms of food affordability, and on the other hand, paying the true cost of food. For example, I'm a farmer. So for me to produce a litre of milk in Ireland, my production cost is 26 cents. From the co-op, I get 28 or 29 cents per litre. In the shop, that same milk is sold for €1.15. There's a huge problem, and this goes into the companies, like the middle people, the how we've commercialized the food system. Like, that's 95 cents of a profit. That's 2 cents has gone into the farmer's hand, and the rest is the producer cost, or is the processing cost. So I think this is a key issue. Food affordability is fundamental. If we're not tackling this, we're just talking to ourselves.
Well, thanks so much, Pat. I think Matilda, you want to come in?
Thank you, Mike. Yes, I wanted to react to that because I think this is actually, yes, one of the main issues really is to the accessibility of nutritious food and not just any food, because like as we are talking about nutrition, talking about the nutrients that people need, and especially children early in life, is crucial for this conversation. But I wanted also to add, as when we try to understand the underlying causes of malnutrition, especially for women and girls, we found that a lot of socio-economic issues are at hand. And we found, for example, that if they don't have nutrition education, or if they don't have access to nutrition healthcare services, which has been the case during the pandemic, and so many other underlying causes such as lack of breastfeeding information, lack of education, as I mentioned, etc., then the right to adequate food cannot be achieved because it's so dependent on other interventions and on other rights, such as right to education, for example, and the right to access to health. So I think as it really depends on so many others, this is where the examination of social determinants is really complex. Over.
Thanks so much. Thanks so much, Matilda, for that comment. Quite research. And maybe if I can reflect on the true cost of food, maybe we haven't yet really realized like to how much does it really cost to buy a highly processed food and to cook for your own nutritious food. You find out maybe that buying a highly processed food seems to be very cheap than cooking your own nutritious food. You're looking at the issues of energy, water, and the like. So all those have to be taken into consideration for if I want to try to make sure that people have access to safe and nutritious food. Matthews, I see you have raised the hand. Can you come in?
Thank you very much, Mike. So apart from just looking at some of the drivers like affordability, I also feel some lessons from some of the disasters that we've seen
in the past few months and years, where droughts, floods have affected people. Like for floods, for example, like that have just affected people's food production. One of the things that we've come to notice that also affects the rights of the people is government responses. So a good example is Zambia, where you had a population of about 2.3 million people who had either faced floods or droughts and had no food at all. And you're seeing government responding with relief food and not really taking food that meet dietary needs of the people, like just taking probably food that like maize meal to those people, simply because that's what the policies that they have for relief food would really advise them to do. But this is quite common in a number of Southern African countries, like where the food response does really, take into consideration the rights to food, because the right to food, you are looking at the dietary needs of the people, you are looking at the aspect of nutrition and the like. So I felt that, this is a submission that I can also bring, that accessibility, affordability, all of these are key aspects, but also when it comes to government responding, because they have the responsibility of feeding all the people that would be in disasters and making food available. But as long as it does not really meet their dietary needs, not taking the nutrition aspect in it, then it compromises their right to food as well. Thank you.
Thanks so much, Matthews Pro, for bringing those comments. I think, you're quite right. Government has the responsibility when it comes to the right to protect, respect, provide. All those are a critical aspect of the government, and they need to really focus on providing the nutritious food should be come clear in our policies and in our strategies. So,
and I think, if I may add, like I think that the social protection, but where we can COVID-19, this is exactly what Matthews pointed out in Zambia, is that what was delivered was energy dense food, not nutritionally adequate food, and hence the rise in child maternal malnutrition and child mortality. So I think it is a key. It's not just about delivering food, it's delivering the right food at the right time, particularly in this time of COVID.
Thanks so much, but I see a hand from BP. Want to come in?
Yeah, thank you very much. If I may just expound on Matthew's point and next point as well. I think what we have observed during COVID, we had written a paper as AUDA NEPAD last year that pointed to the fact that, the first set of foods that will leave the food basket are the nutritious foods, because people simply can't afford it. So now people are left with, relying on starchy staples and everything, as the gentleman from Zambia noted that during the times of, let's say, famine and hunger, or any strife, natural disaster or whatever, the tendency for government is to first just, think if they're giving maize meal is enough, and that maize meal may not even be fortified with the essential vitamins and minerals. So we have a problem from a policy point of view, from being able to move from a disaster situation to actually a developmental, situation that takes into account the safe and nutritious food and looking into the affordability aspects, as Pat said. So just wanted to buttress that point. And unfortunately, what I've noticed that, there is so much, which there's nothing wrong maybe with, but there's so much emphasis around vaccines instead of around good nutrition for people to be able to have strong immune systems and therefore be able to prevent, mitigate, and manage the COVID situation. So we have only 57 seconds before we go to the room.
Yeah, we have really less than probably 30 seconds to go to the main room. So I hope, John, you have captured enough of what has been discussed here. Perhaps a quick reaction in terms of what do you think would be the response strategies that can be developed on issues that we are talking about, looking from issues of accountability, the right food and the like. So a cross-sectoral strategy, what do you think will be the key aspect in terms of developing that strategy?
Are you asking me?
Everyone, of course.
I think for me, I mean, we really have
I think our moderator is still in the room number 2, so we'll wait until everybody is back to share feedbacks. Thank you.
Thank you, everyone. Are we all back in the room? Alex, one of the organizers.
Thank you, Bibi. Yes, the breaking out rooms are now closed.
They're closed. Okay, so we are back in the main plenary. So as noted, we have for each group breakout session, we have 5 minutes for the rapporteur to say a piece. Let me just be strict here so that we have to stop on time at which will be 4 p.m. my time, because I have another meeting that I'm facilitating. It's always challenging. So I don't know if we should start with group 1 or in any order. Saskia, is the group ready to feedback?
Yes, thank you. We have a rapporteur, Soliana. She will present a 5-minute summary of our discussions. Thank you.
Okay, over to you, Soliana.
Hi, everyone. Thank you for having me. My name is Soliana Maaza, and I'm the Policy and Advocacy Director at 1000 Days, and I'm representing the conversation from Group 1. So our group was focused in on the 1000-day window and why it's important to women and families. So I'm just going to go over some of the key points that we rose in our group. So we spoke a lot about breastfeeding, and, you know, a lot of the times when we're focused in on breastfeeding, we think about it in the context of the benefits that breastfeeding gives to the child, but we also highlighted in our group that breastfeeding also provides a number of health benefits for both women and children. So it's important that women are educated on why exclusive breastfeeding in the first 6 months is important and the health benefits for both them and their child during their breastfeeding journey. We spoke about empowering women with the information they need to make the best and informed decisions for themselves and their families. We recognize that everyone's circumstance is different, and we do promote exclusive breastfeeding for the first 6 months of life before introducing complementary feeding. But we also acknowledge that, you know, post that 6 months, a lot of women's, work life and home balance circumstances are different, and it's our job to just ensure that they have the correct and true and scientific information so they can make the best choices for themselves and their families. We spoke about promoting enabling environments for decision making. We also discussed the social norms and behavior change. We also discussed social norms and behavior change and common challenges involved in creating change in social norms, like accessibility of information, especially at the community level. You know, there are a lot of resources that are put out and that aren't translated into all of the necessary and needed languages, so folks can absorb that information. And we spoke a lot about, you know, combating all of the misinformation across social media, marketing platforms, and other mediums that really contradicts the value of breastfeeding in the first 1000-day window. Some of the other key interventions that we highlighted and spoke about that are key in the first 1000 days were providing all pregnant women with prenatal vitamins. And then we spoke about how not all interventions are just nutrition interventions. We also need to really highlight and focus in on some of these social protection interventions to provide the best nutrition for women, children, and families in that first 1,000 days. We recognize that, interventions cannot be delivered in silos. There are interventions within food systems, health systems, social protection, et cetera, that are all needed to supply families in the 1,000-day window with adequate nutrition to thrive. We focused in on producing more locally produced and low-cost nutrient-dense foods available. Some of the things we thought that could support women to have more agency, have better incomes, and be better decision makers would be to establish climate-smart agro hubs that assist women, smallholder farmers, and women and youth to be entrepreneurs in the food system and to produce high-quality foods for their local communities. We thought that we could, learn from some of these successful behavior change campaigns to effectively address perceptions and invest in informative research. And the last thing that I'll highlight that was a big part of our conversation was how to create and develop political will. And that's something that everyone on this call here today is focused on and can support. The advocacy and policy interventions that are also deployed and utilized to help inform governments and change systems are also really important in creating those enabling environments for women and children to thrive in their first 1,000-day window. So, we're really thankful for everyone on the line today and everyone that is involved in this work, because, all of the things that I have spoken about previously also cannot, just change on their own. We do need folks that are working to change political will and support governments to make the best decisions for their constituents. And everyone here today on this call can help support that work as well.
Thank you very much for hitting the time on the mark. You exactly took 4 minutes and 28 seconds. Thank you so much. So can we move straight away to the second group? Mike, are you ready? Mike, is your team ready?
Yes.
Yes, I think.
Please go ahead.
Yeah, so this is John. Greetings from Nairobi. So for our team, we had lengthy discussions on, accountability, human rights and accountability in relations to food systems and the discussions that have been ongoing. And we had very good, contributions from the team. The first one that I wanted to mention or to highlight was the need for focus to women and children who die due to malnutrition, because mortality of women and children is one of the things that contravenes human rights, and especially if it arises from malnutrition. And that was something that was really given lots of focus on. And tied up with that was the, supporting adolescent girls, especially those ones who are pregnant. We've seen high numbers of pregnancies among adolescent girls. And if they do not have proper access or, micronutrient supplementation during that period, then that will also have serious impacts or ramifications for them in terms of health and even for their children. Then there was the mention about UN food systems to really talk about food sovereignty and seed sovereignty to protect and promote the right to local consumption and the growing of the different local and indigenous or traditional foods, and especially now to ensure that where countries or communities or cultures have certain foods that are very, very nutritious, they're given that sovereignty and supported with seedlings and other farm inputs to ensure that they promote and protect these nutritious foods. Then there was another mention from the team members, how to strengthen right to food in malnutrition context, especially on access to food. And this was a really interesting one because the discussions on when we have disasters, what happens? Government responds directly by giving, cereals during disasters, maybe floods or maybe, security-related displacements. And so we find that this does not meet the, the human rights in terms of addressing their right to food, because sometimes they may not really want to consume such kind of cereals at that time. And that was a very strong point that was mentioned. Now, in terms of challenge into putting into place the accountability mechanisms, how do we make accountable, or governments accountable, or teams accountable, or stakeholders? We, team members mentioned about how to follow up on commitments and pledges for accounting for human rights, which of course is missing out in most of the different recommendations for the UN food systems dialogues that have been carried out, and it's something that team members echoed that really needs to take precedence. Then government coordination of policies beyond commitments, a very key component to ensure that not just doing the talk, but acting, walking the talk, and ensuring that these commitments meet the human rights ceiling. Then for better accountability, there was a comment that was mentioned, which was very key for us to note. For better accountability, we need adaptations of planning and monitoring systems to track goals and indicators, a very key component. And this was tied up with the story about Latin America that have really establish strong mechanisms to promote consumers' right for choice, to make choices to make when buying food or when promoting food. And there was a mention that Latin America has also supported the parliamentarians to get involved in educating smallholder farmers and consumers at the local level, which is a very good thing. And through this, other countries could learn and imitate what the Latin America countries are doing. Then in terms of accountability at human rights and global level, has not been given good attention, and this was mentioned, and this should really be given a high priority. So in terms of recommendations, and before that, let me just mention about the social norm drivers that team members also came up with or mentioned. Food affordability was mentioned as a deterrent to achieving rightful access to food. Regulations on commercialization of foods to achieve accountability and accessibility. And there's a story about how production of milk ends up so expensive in the supermarkets or in the where they are sold, whereas the farmer feels the heat when during production. Then the last one was on the recommendations, which I just want to mention very fast. The need for advocacy, legal instruments to define hunger and how it affects women and young people. This was a very strong point in terms of recommendation. And then the last one was mechanisms to help countries to track progress for the SDGs, the Sustainable Development Goals, that will also reflect on very good and strong tangible food systems. Thank you so much. I hope I was able to hit the point at the right time.
Absolutely. You did very well in terms of time. So last but not least, Asma Latif, is your group ready?
Yes, Malama will present our recommendations and challenges.
All right, thank you. Thank you very much. Thank you. My name is Malama Mwila, and I am representing Group 3, and I come from Save the Children East and Southern Africa and the Right to Grow project. Summary in terms of what we were addressing, our group was looking at women as key economic actors within the food systems. And in terms of the key challenges that the group identified, I would group them into 3 or 4. Women are often not part of the decision-making table. When decisions are being made about food systems, they are often not at the table. And even when women are at the table, one would argue that it's not necessarily the right women, in the sense that you're not getting the women from the grassroots who are actually doing the farming. It's sort of other women representing other women, but in reality, there's need for more spaces. One of the key drivers or contributing factors to that, obviously, is social and cultural norms that contribute to a lack of women participating in decision-making processes, and which often also would lead to things like lower wages for women. Another problem that we identified was existing policies do not adequately recognize the role women play in food systems, and so that needs to change. Women lack control over production resources such as land, indigenous seeds, for example, or capital to invest in agricultural systems. Then the last challenge we would lump in together would be the lower levels of education and literacy among women disadvantage women from getting a high return for their participation in the food systems. So those are the challenges. And in terms of the solutions we identified, I would group them into three. We felt that there is need to decentralize power systems to allow for more women to take part in decision-making on local, regional, or national budgeting systems. There's need for more women in forums such as parliament, local or regional councils, so they can themselves influence budgets and gender-sensitive policies, land policies, among others. We also suggested that we would need to address social and cultural norms that leave women on the periphery of the food systems. For example, by engaging men and women on transformative practices that include access to land and education for women. We also felt that access to education is likely to delay entry into agriculture for women and will therefore allow them to enter at a later age when they are older, and that would mean that they will be able to access returns in the agriculture value chains at a higher level where incomes are likely to be higher. We did give an example of a child, for example, entering agriculture sector at the age of 10 years. By the time they are 20, they've not even had access to an education. Their level of income will be low throughout their stay in the agriculture sector. But the longer you delay the entry into agriculture, the longer they will stay in school and the longer they will be able to stay out of the system and be able to enter at a higher value chain. Well, the last one would be strengthen community-based organizations, lobbying and advocacy capacity to ensure they have a stronger voice for women, youth, children, and other marginalized groups. We must support them to have a stronger voice and demand for accountability on public investment decisions at local, regional, and national level. I think that's hopefully a good summary of what our group discussed. Thank you.
We're right on point. We took 3 minutes and 23 seconds. So I think we are coming to the end of this really rich and enlightening discussions. And I really appreciate not only the speakers, but the participants, the groups, as well as the organizers. So at this point, I'm going to do something slightly differently. I'm going to ask the speakers from the plenary to just give me, not much, I don't need much, just 1 or 2 things that you think we can do differently. Starting with the first speaker. In 1 or 2 things, only in less than 30 seconds.
Sorry, Bibi, Inge had to leave the call. So if we could direct the question to the second speaker, please.
Okay, then we can go to Terry. Terry, do you have some thoughts? Terry, are you there, or you also left the group? Okay, then we can go to the third speaker from Bangladesh. Kisa, do you have any thoughts?
Hello.
1 or 2 things, just really what we need to be doing different in order to, bridge this gap of gender equality or inequality, just in less than 30 seconds.
Yes, thank you very much. I think our youth generation, they are the big strength of us, and we need to focus on how we can engage them into our development works and contribute to our all initiatives, and especially for nutrition and the food safety. And I want to just say one thing, I want to relate one thing with COVID. We have our diabetic society. They have started one survey among young people, they went for diabetes test and high blood pressure checkup, and also eyes and other checkups. And they found that due to this COVID situation where youth actually remain idle in their home, they have lot of obesity, they have lot of high blood pressure problems, and as well as diabetic problem. So I think for me, it's very important to focus on these issues to mitigate this, gap of food and safe food, having safe food, nutritious food, and how to deal with this situation. Thank you very much.
Thank you very much, Cassie. So in about 1 minute, I'll try to summarize, and then I'll hand back over to the organizers to let us know what the next steps will be. So what I had coming out very strongly, I mean, I'll put it in terms of key words or key sentences. We've heard that 1,000 days is very important, not only from a point of hunger, but also from a real nutritious and child growth and development point of view. The second thing that I picked up is that we need to have really to understand the true cost and affordability of not only the production of food, but the purchase of food, the availability and the accessibility. We also have that, the right to food sometimes doesn't really take grasp, because it is either not incorporated or inculcated in our policies. And many countries have not acceded to that. And then there was the question of really, what is hunger? It can be relative, but hunger is hunger. You can be hungry physically, or you can be hungry mentally, or you can be hungry, within your organs, because you don't have the right vitamins and minerals. And then there is a huge issue of country accountability. How do we get around in ensuring that countries are accountable? It was noted that we need to start from the grassroots. If that community woman who hasn't had a voice cannot be at the table of making very important decisions, then a lot of things will fall through the cracks. Then there was the issue of socioeconomic issues. How do we deal with the enlarging gap of ensuring that women are not left behind, the youth are incorporated as policymakers as well in the decision making and the translation of research to policy, to program, and to implementation. Then breastfeeding, of course, is a very, very important issue, not only because it benefits the child, but also it benefits the mother from very many aspects which have not been spoken much in the recent years. I remember the 70s and the 80s, there was a big push for that. And then promotion of the local smallholder farmers, medium enterprises, and the value chains thereof, so that people really know what they're eating. And women and the youth can also be accountable and support the accountability through different communication strategies and different media avenues. Then going back to the basics, the traditional and indigenous foods, how do we make sure that we bring them back in so as to promote the culture, the nutritional aspects, as well as their own development? And then the policies in terms of government, they have not been coherent or cohesive. So we need to find a way to melt those silos and to make sure that every aspect that concerns food systems, gender, youth, and socioeconomic development are speaking to one another. And then we spoke about the coordination. I've already said that. And then ensuring that the civil society, together with the private sector and the government, can find a way to have really proper public-private partnerships that are functional, not only on paper, but really to ensure that there is development. And then very high recommendations on how food sovereignty can be taken on board for inclusion and contextualization of the challenges across different sectors. So from my side as the overall moderator, let me once again thank the organizers for choosing me as your moderator, and thank you to the side groups, the breakout sessions, and thanks to our interpreters without whom we could not be here. And thank you everyone who has been a part of this, whether as a sponsor, as an organizer, or as a partner. And I shall just say once again, it was very rich. I hope the moderators and the rapporteurs have captured everything, and everything that was in the chat box will be published and will form part of the notes. So over to the organizers from my side, and on behalf of my organizations, FAO and AUD and EPAD, thank you very much for the opportunity and the honor. Thank you once again.
Thank you, Bibi, and thank you so much for your great moderation during this session. We're really glad that you led our discussions, and thank you to all the moderators as well for the great chat that you had in breaking up rooms. So very quickly now, because we're past the time, but just wanted to let you know that now ICAN and SUN CSN will work to make sure that the feedback of this conversation and the outcomes will be reported to the UN Food Systems Summit to influence the process and participate in the overall independent dialogues process. So thank you very much for all the conversation that happened today, and see you soon.
Thank you. Merci beaucoup. Muchas gracias a todos. And a la próxima. Merci.
Merci.
Many thanks, everyone. Bye.
Bye.
Adios.
Bye. Adios.
Bye. Thank you.
Bye.
Many thanks. Merci beaucoup.
Many thanks.
Bye.
Ciao.
Thank you very much. Take care.
Ciao.